So I'm going to be this evening telling you about the CoSPACE study, giving you some information about some of the findings that we've had, and then, like Pete, giving you some tips around parenting. And then I'm going to finish off by giving you some resource ideas that hopefully you will find helpful. So let me kick off by telling you a little bit about the CoSPACE study. So I know Kathy obviously has already explained this, but essentially our study is for children who are school age, so from 4 to 16, and it involves parents reporting on their children. But also there's an opportunity if adolescents are to be involved as well. They can also report on their own experiences if they're aged 11 to 16, which is brilliant that we have both parent and the young person's report. So let me tell you a bit about the timeline. So, gosh, it seems a while ago now, doesn't it? But on the 23rd of March was when we locked down in the UK, and we got the CoSPACE study running a week after that, which was great to be able to sort of really quite rapidly start to find out about the experiences of families. And so parents are obviously joining us to take part in the study at any time. But what happens is that the parents complete the study at baseline, and then they complete further studies at monthly intervals, and that's going to go all the way through until 1 month after lockdown has finished and all the schools are completely reopened again. So far in the study, we've had more than 10,000 parents and carers taking part, which has been brilliant. And that's really important because as has already been mentioned, we are feeding these findings regularly back to policymakers and professionals, because it's really important to us that if we're getting all this information and parents are very kindly giving up their time to complete the survey, that information makes a difference. And in fact, we do a lot of extra reports in response to policymakers. So very often they'll come back to us and ask us for very specific information, and we turn that around quite quickly so that we can provide that information to inform policy. And we're also really keen to feed the survey results back to you as parents taking part, and to members of the public more broadly. So that's through written media. So we've done quite a lot of work with national and local papers, but that's also through the radio as well. So both Kathy and I have done some sort of various radio shows, and also through TV as well. So we had some good coverage a couple of weeks ago on BBC Breakfast. So let me now move on to tell you about our findings. So actually, we also started looking at parent stress, and it's interesting listening to Pete's findings from the CoSPACE study, because actually we found a very similar pattern in CoSPACE. So when we asked our parents what the main stressors were, actually they reported exactly the same pattern, in that work was the #1 stressor. So this sense of parents really struggling to juggle both work and the needs of their children. And then second to that came their children's well-being, followed by concerns about their family and friends outside their household. And then since then, we've been moving on to explore mental health. So we've been looking obviously at young people's experiences over the course of lockdown. So we've had parents filling in the survey, and for the first time we've looked at changes over the course of lockdown to see what's been happening. So when we're looking at children's mental health, we're looking at 3 different areas. So firstly, we're looking at their emotional well-being, so things like being clingy, feeling worried or feeling sad. We're looking at their behaviour, so things like not doing what your parents is asking you to do, having arguments, temper tantrums, and then difficulties with restlessness and being fidgety, or difficulty sustaining your attention. So those are the 3 areas. And actually, with a lot of our reports, we've been looking at the 2 different age groups separately, because we've been finding quite separate patterns depending on the age of the child. So if we start off with the children who are primary school aged, actually, when parents reported on what was happening over the course of lockdown with their children, actually what we found was parents reported an increase in all these kinds of difficulties. So in terms of emotional difficulties, behavioural difficulties, difficulties sustaining attention and being fidgety, they noticed that their children, things were getting worse over time, their children were struggling more. And actually, interestingly, that's in contrast to what we found with parents who have a child of secondary school age. So actually, they reported that there was a reduction in their children's emotional difficulties. And actually, the teenagers themselves reported that there was no change. So certainly things didn't seem to be getting worse. but there was an increase in restlessness and attention, which is perhaps understandable over the course of lockdown. And again, no change in behavioural difficulties. So that was interesting. It's important though for us to say that obviously there's going to be huge variability, and that's one of the things that will become really clear as we come out of lockdown. So, and our sample isn't a nationally representative sample, so it overrepresents families from higher incomes. So there are certain characteristics that we're really keen to explore more, and in fact we're going to be doing interviews to be able to better understand the specific experiences of some young people and their families. Okay, so there's lots of data in our reports, but obviously we're really tight on time for this evening. So if you would like to find out more, do go onto the Emerging Minds website, where all our reports and the CoSPACE reports are there too, so that you can have a bit more time to take over looking at the findings. So let's move on now to think about practically what as a parent can you do to support your child's mental health during the course of the pandemic. So my first point really is don't panic. Feeling sad, worried, angry is actually a perfectly normal response right now for all of us, not just our children. And on the whole, children are actually incredibly resilient. So for many of them, actually being able to go back to school, see their friends again, take part in normal activities, all of those things are likely to mean that these difficulties improve. How they are behaving now does not mean that your child has turned into a different person. So really don't panic. And the second important point is that given all this constant uncertainty, it's really understandable if your children do have worries. So if you can see that something's bothering them, then do try to talk to them about it, try and listen, try not to brush it off or dismiss it in any way. And also it's really important that they can see that you have worries too. We all do right now. But the important thing is for them to be able to see that you have strategies in place to help you cope with it. Okay, so, and then the next point is about problem solving and taking action. So when we feel anxious or down, we often try to avoid things, but actually this inadvertently often makes things worse in the long term. So look for anything that your child is avoiding and then encourage them to do the opposite of what the worry is telling them. And encouraging your child to do things will actually increase their confidence and their belief that they can handle things going forward. And also doing activities that your child values and enjoys will be a really important boost to their mood. And so try to move away from problems into coming up with solutions, and try and get your child involved in problem solving too, so that they can come up with ideas for things, how they can handle things differently, perhaps how you as a parent might handle things differently. And as a parent, it's important for you to compromise. Okay, and my final point is about rewarding brave or good behaviour, because sometimes when children are worried and sometimes when their behaviour is not so good, all the energy and the focus can very much go into that. So instead, actively look for times when your child's doing what you want them to do and give them loads of praise. And many children, especially younger ones, can be really motivated by things like rewards charts. So definitely use them if that really encourages your child to behave in brave and positive ways. Okay, so now I'm going to talk about some resources, and I think Andre might be putting some links up as well, and obviously these slides will be accessible afterwards. So one of the sites that's really helpful is the Andy website. So Andy's a research clinic based at the University of Reading, and they have some resource lists for various books, all sorts of different resources for parents, for young people, and for professionals. So do go and have a look at the suggestions that they have there. But two books that we typically recommend for children of primary school age. So for those that have worries and fears, we recommend a book written by Kathy and a colleague, Lucy Willits, Helping Your Child with Fears and Worries. And also for children where there are issues around behaviour, we would recommend The Incredible Years. And both of those resources have a really good evidence base underpinning them. And then for resources for young people of secondary school age, for those that are experiencing low mood, we'd recommend the books by Shirley Reynolds and Monica Parkinson. So there's one for teenagers themselves, and then there's another one for their parents. And in terms of books related to worry, the Overcoming series, which actually is written for adults, but the books are suitable for adolescents, that series can be really helpful. There's a book on anxiety, as you can see here, but actually there's a whole range of books focused on a number of different mental health and other common conditions. And then the Emerging Minds has a really good resource on supporting your child with worries about COVID. And then there's a webinar series that you might find helpful. And then finally, there are free online courses on anxiety and low mood in young people. So the one on anxiety has been designed by clinical researchers at University of East Anglia. And then there's one on low mood based at the University of Reading. So do access those as well. And thank you very much for listening. And thank you very much for everyone who's continuing to take part in the survey.
Some of you may already be taking part in these studies. And if you are, that's fantastic. Thank you very much. Please keep going with it. These studies are called CoSPACE and CoSPACE. CoSPACE is a study that's specifically focused on preschool children and how they're getting on during the pandemic and how their families are getting on as well. And CoSPACE is focused on primary and secondary school age children, so from 4 to 16 years of age. And again, it's very much focused on understanding how children and young people are getting on, how their families are coping, and trying to really understand what's helping families through this time, what sorts of things seem to be supporting children and young people in terms of their mental health and well-being, what sorts of things are causing challenges for people. And as you'll hear as we go on, we're really trying to make sure these findings can be as useful as they possibly can by regularly feeding them back to people who can use them to make a difference and make life easier for families.